Welcome to Your Health with Alivio Medical Center. We are today with Lindsay Pimentel, our nurse practitioner here at Alivio. We're going to be talking about something that many patients ask you about. So when they have these upper chest pain that they believe is gastritis, and why don't you tell us a little bit about when is gastritis or what other things can be leading to those common pains?
Okay, hi. Upper abdominal pain, sometimes underneath the chest bone, is called gastritis, and oftentimes people present to the outpatient clinic with this kind of burning sensation, uncomfortable sensation, sometimes made worse by after they eat. But it can be other causes as well, not just gastritis. Sometimes it can be problems with the gallbladder. Sometimes these same symptoms can manifest and actually be indications of heart problems. So we recommend that all patients that have these symptoms for more than 4 to 6 weeks come in. Symptoms of nausea, vomiting, weight loss, black stools. Those are kind of warning signs that if you have those signs associated with this pain, you should definitely come in and consult your doctor. We have tests here available that we can check for a common bacteria called Helicobacter pylori. That bacteria causes reflux, this upper abdominal discomfort, and there's actually treatment for it. So we first would detect to see if the bacteria exists. You come back in a week, and if the bacteria is there, we can treat it and hopefully get the patient some relief of those symptoms.
Okay, so what can people do to prevent situations like this kind of medical problem? So is there any prevention that can be done?
I would recommend more like a bland diet. If you're having these symptoms continuously, avoid chili, alcohol. Those are kind of some things, spicy foods that would cause exacerbation or worsening of your symptoms.
Being this something somehow common in our community, so it sometimes people can be prone to actually go and auto-medicate or just go to the store and buy something that somebody recommended. What do you have to recommend patients about this kind of?
I strongly suggest that patients avoid kind of home remedies and auto-medicating. First of all, like I said, it can be signs of something else, and you don't want to kind of mask the symptoms of potentially a heart issue, or if it's a gallbladder issue, if it's something besides gastritis. Even just gastritis, auto-medicating is just not a good idea. So I would recommend patients with these symptoms come in and consult. And like I said, there are great medications available on the market today that we can get our patients on these medications and feeling better.
Okay. What are the causes of these conditions? What is the common causes?
There are some common causes. Like I said, one of them is the bacteria Helicobacter pylori, which is a bacteria that grows in the intestine and causes symptoms of reflux, kind of sour taste in the mouth, burning esophagus, and kind of this burning sensation that is what usually brings people in. So the first cause would be a bacteria. Another cause could be, like I said, an actual chest pain, a problem with their heart. Here at Alivio, we also have EKG. We can make sure that it's not an acute issue with the heart and further investigate. And the other most common cause, I would say, is gallbladder. So problems with the gallbladder sometimes can mask the same symptoms of gastritis, worsening after fatty foods, spicy foods specifically. So I would say those are the top 3 other causes. Some warning signs to be on the lookout for are change in the consistency and color of your stools, persistent vomiting, and weight loss. So those are kind of warning signs to definitely consult your doctor, and are also indications for an endoscopy. Here at Alivio, we can kind of coordinate an appointment for you with a specialist for the endoscopy, as we don't do those here in the office.